Hi guys, we're going to talk about comfort and rest. This is chapter 20 in your book. So basically what we're talking about here is sleep and then pain, how to keep people comfortable. So this is a pretty important concept for you guys to grasp. So sleep requirements we're going to talk about first. As you can see with this chart here, sleep requirements decrease as we get older, but from the age of about 18 on, we kind of need the same amount of sleep. We need about 8 hours of sleep per night, which probably most of us are not getting. On average, people in that age range average 6 to 7 hours of sleep, which means that a lot of us are chronically sleep deprived. So that's not a good thing. And then when we think about our residents and our patients that have a lot of other things going on, they're probably even more sleep deprived. So our job is to try to get them to get as much rest as possible. Rest is important because it re-energizes you, it strengthens your immune system, it helps you heal and repair. That's when your body re-energizes as it's resting. Your brain, every single system needs rest. So when you're not getting that rest, you know how you feel. You feel down, you feel tired, you feel irritable, and you're not able to do as much, can't think straight. We've all kind of been there, so we want to make sure that the people we're taking care of are getting as much rest as possible. There are a lot of things that can interfere with our sleep, especially when we're talking about residents and patients. So being in a new environment in itself is going to make it difficult for you to sleep. If you think about when you're in a hotel or if you're staying at somebody's house and you're in a bed that you're not familiar with, it's hard for you to relax. So it's the same with our residents and our patients. If they're in a different environment that they're not used to, with different smells, with things that feel different, with different sounds, it's hard to really relax and get that deep sleep. So we want to try to maximize their comfort level. So if there's a certain blanket or pillow that they like, we'll try to accommodate them as much as we can. If somebody's emotionally upset, if they're sad, or if they're angry, or maybe worried, that's going to make it hard for them to sleep too. You feel, if your kid hasn't come home and you're wondering what they're doing, you can't relax. So imagine if you're a patient in a hospital and you don't really know what your diagnosis is, you don't know if you're going to get better. It makes it hard to relax and sleep. Pain also makes it hard to sleep. A lot of the people that we're taking care of, they are in pain, whether it's acute or chronic pain. We want to do anything that we can to help relieve some of that pain. Going to the bathroom makes it hard to sleep. So this is something you should do before you put your residents to bed at night, or your patients, is take them to the bathroom so they can empty their bladder or their bowels and have a restful night's sleep. They don't wake up in the middle of the night and need to use the bathroom. And then if you have somebody who's on oxygen, make sure that that's working, that it's attached to them, because if you can't breathe, you can't really sleep well. And a lot of the people that we take care of, they have respiratory issues. They have COPD, or maybe if they're in the hospital, they have pneumonia, and they're having a hard time breathing. So, make sure that they have what they need. So a couple of the sleep disorders that your book mentions are insomnia and sleep apnea. So somebody with insomnia has trouble falling asleep or staying asleep. So maybe they just can't get their mind to slow down, can't relax, or they fall asleep fine and then wake up 20 minutes later, 2 hours later, and can't get back to sleep. So I think we've all kind of been there at one point or another, but this would be for somebody that has it all the time. Sleep apnea is somebody who has periods of apnea when they're sleeping. So if you've ever heard somebody snoring and then suddenly they stop and they kind of stir a little bit and then it seems like they're sleeping again, they might have had sleep apnea. That's kind of what it sounds like. So your sleep is interrupted constantly throughout the night. Somebody that has this might not even realize that this is happening to them. But they're constantly waking up, so they're not getting that deep, restful sleep, but they're not getting into that REM cycle that regenerates your brain, helps you think and remember things. So when they wake up in the morning, they feel exhausted, almost like they didn't sleep at all. And this puts a lot of pressure on your body, especially your cardiovascular system, your heart. It's not really resting the way that it needs to. So blood pressure is going to be higher, and they're going to be at higher risk for heart disease because of this. So these are things, if you notice, you need to let your nurse know. If you walk by your resident's room, you see, it's 3 o'clock in the morning, they still haven't fallen asleep, you need to let them know so that maybe there's something that the nurse can do. This is a really good video that I would like for you guys to watch at home. It talks about sleep hygiene, which is something that we should all be doing. Things that help to maximize your sleep. So that would be, for example, turning the lights down in your room, making sure there's not a lot of noise, background noise, going to bed at the same time every day, waking up at the same time in the general area, turning off electronics, not having your phone right next to you when you go to bed at night, or watching TV until you fall asleep. Those are bad habits. Those need to stop. Or, drinking caffeine before you go to bed. Exercising right before bed. Those are all things that we do that make it harder for us to get that restful night's sleep that we need. So you need to educate your resident or your patient on what they can do to sleep a little bit better at night, because it is so important. So pain is also part of this chapter. One thing that you just have to learn now is that pain is whatever the person says it is. There's not really a perfect way for us to measure how much pain somebody is in. We have to go by what they tell us. So somebody could have acute pain, which is short-term and usually goes away. Chronic pain is long-term and it lasts for usually more than 6 months. Whenever somebody tells us that they're having pain, we need to assess that pain. So I need to know, first of all, where it is, how bad it is, and usually we use a scale of 1 to 10 to rate that pain. So just like you can see on this picture here, 0 is no pain at all, and 10 is the worst possible pain that you could ever have. I need to know what it feels like. So is it stabbing, burning, stinging? Does it feel like somebody's crushing you? Those tell us a lot about maybe where that pain is coming from, if it's muscular or nerve pain, for example. Then we need to know when it started. Is anything making it worse? Does anything help it feel better? So if you have a resident and they tell you, I'm having pain, these are the kind of questions that you can ask them. That's going to make it a lot easier for the nurse to know what to do about it. There are some factors that affect how we respond to pain. So obviously your tolerance. Usually tolerance builds up as we get older. If you think about, my 6-year-old, if she stubs her toe, the world will end. It's over, because she's never had anything this terrible happen to her in her whole life. Where for me, that sucked, but I've had a baby, so I can kind of gauge how that pain is, and I'm probably going to handle it better. And then everybody's threshold is different too, For example, redheads have a lower pain threshold usually than somebody who's got darker skin. That's just the way that they were created. Culture also affects how we respond to pain. Some cultures are just naturally stoic. That's how they were taught to respond with emotions, so they might not complain a lot. So that's why it's helpful to ask people to rate it on a scale of 1 to 10. That gives you a more accurate measurement than just looking at their behaviors. Now, if somebody can't tell you, oh, it's a 10 out of 10, then you do need to look for those nonverbal signs, like grimacing, moaning, guarding that area. Like kids, if they have an ear infection, they might pull on their ear. So look for those things to indicate, hey, this person's uncomfortable. So something I want you guys to learn now is that the answer to pain is not medication. There are a lot of things that we can do, especially as a CNA, to make somebody more comfortable. You can reposition someone, you can distract them. That's very effective. Get their mind on something else, especially if they have chronic pain, because maybe that pain is never going to go away, but they can still get involved in an activity or watch TV or read a book, and it gets their mind off of it. Massage is also very helpful. So you can give them a massage, especially if it's muscular pain. That seems to really, make them feel good. And then we're going to talk about hot and cold therapy. So hot and cold therapy is not something that you should decide is appropriate or not. But if it's on their care plan that they can use hot or cold therapy, or if the nurse tells you that they can, these are some things that you need to know about it. So just, first of all, heat dilates, right? So if you're hot, you get red. That's because your vessels have dilated and your blood is rushing to the surface of your skin. So it increases blood flow. So we would use this maybe if we're trying to increase blood flow to a certain area to make it feel better. So this would work really good for sore muscles. Probably not something like a sprained ankle, right? Because it's going to increase blood flow, that would increase swelling, and then increase the pain. So you kind of have to think about what would be appropriate. If you are using a hot pack, you need to make sure that you check that area every 5 minutes. If it looks like it's getting red, you need to take it off, okay? People who are high risk are obviously the ones that are going to have impaired sensation because they can't tell you this is burning my skin, or if they're very fair skinned, then they're going to be just naturally more sensitive to things anyway. So always use caution when you're using heat and cold therapy. So if heat dilates, then cold constricts, right? So this decreases blood flow to an area, and that can help relieve pain. So there are certain situations where I would want to use cold packs or ice packs, like that sprained ankle. I wouldn't want to put a heat pack on there, but a cold pack might help because it's decreasing blood flow, and that makes it feel better. Or maybe a surgical incision, like a hip fracture that just got repaired. Sometimes we put ice packs on there because it relieves some of that pain. So again, you would be checking this every 5 minutes, and you should never use a heat pack or an ice pack for more than 20 minutes because it's not effective anymore after that. Okay, so those are the basic principles. So some of the stuff you just have to use common sense, and determine what's appropriate and what's not appropriate. So that's the end of that lesson. Make sure that you watch that video so that you can get some good tips on sleep hygiene and hopefully use them yourself. I'll see you later.